Well, welcome back. Episode 11 of Triangle Dentistry Talk. I'm your host, Dr. Carl Bernstein, and today we have an amazing guest with us. We have Dr. Marina Gonchar, all the way from New Jersey. How are you?
I'm doing well. How are you?
Well, today what we're going to talk about and what our goals are for this podcast is to talk about the difference between aligners, a little bit with braces, but more so with aligners, different companies, kind of how it feels, and maybe aligners and at-home aligners as well. So tell us a little bit about yourself, Marina, if that's fine, if I call you Marina.
Yeah, that's fine. So,
So,
so I'm an orthodontist in New Jersey. I have my own practice. We've been open for about 3 years, but I've been doing this for about 10 years, and yeah.
awesome. Well, like I said, she's a special guest because she is a board certified orthodontist. And so she knows everything about orthodontics. No, but serious, it's going to be a good conversation. We'll hopefully be able to relay a lot of information that you'll be able to use if you're thinking of going to get braces or aligners. So let's get started. You ready?
I'm ready.
All right. So, first thing, what most people want to know is what are the benefits of aligners and benefits versus braces?
Yeah, so there's definitely a few benefits with aligners. The number one thing I would say is there's really no changes to your lifestyle, meaning you can pretty much have your same diet, eat whatever you want. There's no changes the way you brush your teeth or take care of your teeth because obviously you remove the aligners for that. It's a lot more discreet than braces, and I would say it's a lot more comfortable and gentle on the teeth, so there's less pain. For adults, there's also the added benefit of less visits. I know everybody's super busy, so they can't make it to the doctor all the time. But with braces, the one big benefit is that it doesn't rely on the patient's cooperation. So with Invisalign or any other type of aligner, you have to make sure that you actually wear the aligner. And if you don't, you're not really going to see the results that you want. With braces, there's not much patient compliance that's required.
And I mean, I think you would probably agree, but the biggest benefit and reason why anyone chooses aligners is because they're clear.
Yeah.
And I think that's, if aligners were black or if they were a different color, I think people would be choosing braces. So it's that clear appearance, vanity, obviously, is a big reason why we choose aligners. So I think another big benefit is people think, especially as we get older, that braces aren't for adults. They make them look like a child. Maybe it doesn't look mature, but I think obviously we disagree with that. We're both orthodontists, and braces can be used with anyone. But that's one of the biggest benefits I think of aligners as well is just clear. That's why people want it, and that's why we have them as well.
Yeah, for sure. Aesthetics is a huge, huge thing. And it's not even for adults anymore, but even for teens. So, it's much more important for them to make sure that, they look cool, they feel good. So yeah, I completely agree with you.
And I think that's one thing that I didn't really even think about again is, we I've put aligners so much more for adults than kids and teens, but aligners can be used for very early kids and teens. Compliance can become an issue, which we'll hit off in just a second, but it really can be used for all age groups. But let's kind of get into the little bit of the cons of aligners. So, what are the biggest disadvantages of aligners?
I mean, number one on the list would be compliance, right? So people don't realize, but you can't just wear them to sleep. You have to wear them 20, 22 hours per day to get the results that you want. And so often people will say, oh, yeah, I can do that. And then it turns out that instead of the 20, 22 hours, they're wearing them 16 or 14 or just to sleep. And the issue is that doesn't quite work for moving teeth. And so what happens is, the treatment time gets extended. People don't get the results that they want. People get frustrated. So I would say that is the number one issue with aligners.
And I'm not sure where is it that maybe an at home. Did they ever mention just to wear them at nighttime? I'm not sure where it seems like a lot of people do come in with the thought of I can wear these just at night or maybe half a day and achieve the same results. But I think that's one of the biggest misconceptions I see with aligners is the amount of time you have to wear it. And then the other biggest complaints that I sometimes hear and see as well is speech. I think
Mhm.
that's the biggest one for adults is a lot of people want to do aligners because they're clear, but then they don't really think about that you're biting on a little bit of plastic and it can give you a little bit of a lisp.
Right. No, that's absolutely true. You know where the misconception I think comes from? Because we do treat a lot of adults with clear aligners, I think they remember, as a kid they got a retainer that they only wore to bed, and the retainers often look like the aligners, they're clear, and so they think, oh, well, obviously this is the same thing. I just wear this to bed and get the results that I want. So I think maybe that's where that comes from. But I agree with you. People don't realize that with aligners, sometimes you get a little bit of a lisp. But I always tell patients, as long as you practice speaking with them,
Hmm.
in 2 to 3 days, you should be able to sound completely normal. But yes, absolutely, speech is a big one.
And then I would say to what I would think is the next biggest complaint that I see and hear as well is the attachments. So there are things glued to the teeth. I think that is the biggest misunderstanding that most people don't know when they first come in is when you say, well, we still have to bond something or glue something to your teeth. They kind of look surprised. What? I thought this was just a clear tray you just put on your teeth. And I think, they don't hurt, but I think a lot of people, it takes a little bit of time just to get used to them.
Yeah, and that definitely that comes from the marketing too, because one of the biggest in clear aligner brands is Invisalign, and they do a lot of direct to consumer marketing. And in their marketing, they never show attachments. And so when patients come in looking for a product like Invisalign, they expect, oh, it's just a clear aligner, it goes on my teeth and it straightens my teeth. But one of the biggest things, the reason why clear aligners work so well is because of those attachments. And so it's a little bit of a shock for some people, and you have to explain to them obviously that they're clear, they're tooth colored, they will stay on your teeth and help the teeth move faster and better. But I agree, that is a little bit of a shock. I actually have a model with me, if you I don't know if you could see, but you know some of the teeth have attachments and they're barely visible on the teeth. But
And
again,
they're tooth colored as well.
they're tooth colored, and so I do think it takes a few days for people to get used to the idea. But I just think the main issue is the marketing. Again, people don't expect that you have to glue something to their teeth for this to work.
And I think, I didn't even really think about that. I don't see too many Invisalign commercials. I guess I don't watch as much TV as maybe some, but I would say you're probably right there. And a lot of it comes from Invisalign themselves. Now, I think a big thing that people, before we go into a little bit of maybe some difference between at home aligners, which a lot of people have heard of Smile Direct Club, but before we get into that, I think a lot of people, their biggest concern as well with any braces or Invisalign clear aligner treatment is speed of treatment. And so, do we notice a difference in speed with aligners versus braces, or is it really like every answer? It depends.
Yeah, I feel like the answer is it depends. If compliance is removed from the treatment, it all depends on how difficult the case is. Some people have had braces before, they have very minor crowding that needs to be corrected. That could be done very fast with both Invisalign or braces. However, if it's a more complicated situation where, even braces would take up to 2 years, Invisalign's not going to do it any faster. And in fact, I would argue that sometimes it's a little bit slower because compliance falls off with time. So once we
Yep.
reach that 1 year mark, people get tired, they get burnt out. So again, it's very difficult to say, oh yeah, and all Invisalign cases can be done in 6 months, because that's simply not true. It all depends on the type of case, the type of compliance the patient exhibits.
Exactly. And I like to tell a lot of my patients that in liners, if it's Invisalign braces, for the most part, if you comply well with wearing those, the treatment time is roughly about the same as what I normally tell them. The
Yeah.
caveat is, and I hate always giving this answer, but it depends, and I noticed big things that I struggle with for patients, is always compliance, but also, like you said, that 1 year mark. After you hit that 1 year mark of wearing those trays, it really becomes a little bit more difficult. Not that the trays are hurting anymore or that they are fitting differently. It's just you get tired of taking them in and out.
Yeah.
So I think we've hit at least a lot of the basics, a lot of what people want to know when they're at least coming into the office or they're just looking for aligners and what to kind of expect. But I think more recent times and maybe the past 5 to 10 years is we've seen a lot of at-home aligner ads, and one of the big ones was Smile Direct Club, which I don't think are around anymore. And then there is Bite and Candid, and if I'm missing all these other ones, I know there's a lot of them. Marina may be able to hit some too, but there is a really big difference between at-home aligners and aligners that you can get into office with either a dentist or orthodontist.
Yeah, absolutely. And so it's funny, that's another thing that I notice is when patients come in, sometimes they've already done these at-home companies, so Smile Direct before they went out of business, or Candid Bite, and they say, "Oh, well, I tried this, but it didn't work for
Hmm.
me." There's a huge difference between at home and, a doctor-directed treatment. And aside from, I mean, I could tell you so many reasons, but the number one thing is, it's not as easy as you think to move teeth through the bone. There's a lot of things that can go wrong. And so, you know, the main thing I want to impart to people is you're really taking a risk at doing these at home aligner treatments because you don't know the state of health of your bone, of the root length, of,
Hmm.
you have cavities, stuff like that. So, aside from the fact that do they work, do they not work, just the fact that you're taking such a big risk on your dental health, people end up losing teeth while doing these treatments because they had underlying conditions that were not diagnosed by a doctor. And the biggest misconception that people don't understand, these treatments are not directed by a dentist or an orthodontist. This is technology companies. This is tech, this is AI. So people think, oh, well, a doctor is surely overseeing my case. No, they're not.
Hmm.
And that's a huge misconception out there.
And I think, I mean, that's the most important thing always with the at-home aligners and the, I guess, DIY if you really want to get really into it. But it's also those attachments that we talked about
Right.
previously is those are something that can't be placed. And Invisalign, I don't know exactly what, I think it was at the 90s Invisalign came around or 80s.
Yes. 90s.
Invisalign's been around for a long time, and attachments really are the reason that started to make it more predictable to move teeth. And that's something that that home can't do because you can't add them on yourself. You couldn't remove them yourself. So that's the biggest issue with at home is the teeth don't move predictable.
Yeah, and don't forget, I know this is a little technical, but there's also something called IPR that we do in the office with braces or aligners. And IPR is just a fancy way of saving, shaving a little bit between the teeth. Now, this cannot be done by yourself at home, but a lot of the times, if you have crookedness or crooked teeth, the way we make room for teeth is just to alleviate a little bit of that tension between the teeth by shaving between them. Again, DIY will not let you do that. And so oftentimes that's why people say, well, it didn't work for me or it messed up my bite for
Hmm.
that reason.
And I think that's the other benefit as well of being able to come to a dentist or orthodontist and going in office is you have someone periodically looking at your teeth, making sure that they're moving predictably, making sure they're moving in the right direction. Orthodontics, it seems, even sometimes to me, it seems like it should be easier than it is. But sometimes it can be little bit more complex, or a person's tooth is moving slow. It could be medication related or etc. There's a lot of reasons why teeth don't always move as we expect, but that's something when you get to go in and talk to a doctor and discuss with them and what's happening, why is it not fitting well, or the tooth isn't moving properly. Those are things you get when you get to go in office. So always I say be wary, of those at home. There's probably plenty of success stories, but I would say there's a lot more failures than there are probably success stories with those at home.
Yeah, I agree with you. And then the other thing that ends up happening is unfortunately people go through these DIY treatments. They don't
Hmm.
get the results that they want, and so they do have to go and get retreated by
And
a
you're kind of spending
dentist.
twice.
You're spending
And
your
so
money twice. Yep.
I would say, on that note, we kind of start talking about a little bit of the negatives, but let's get into some of the positives. So we're coming to the dentist, orthodontist. We're thinking of getting aligners. What's the benefit of going into the office? I know we touched up a little bit on it just a second ago with that IPR being able to make precise adjustments to the teeth. But real quick, what are the biggest benefits of kind of going to the office and seeing a doctor?
Yeah, absolutely. So, number one, again, you have someone looking at your teeth periodically to make sure that there's no negative consequences. So, things like gum loss, bone loss, tooth stability, that's huge. You're also looking to see if you're actually going the right way. Are the teeth moving like they're supposed to, or are they lagging behind? Is there something that needs to be changed mid-treatment to get you to where you want to? The other thing, of course, in the beginning, if you see a dentist or an orthodontist, you're actually getting a treatment plan. So,
Mhm.
there's things that are realistic for us to do, there are things that are not. And so, right off the bat what can be done. So, you're not expecting to go in and get, a perfect smile when maybe that's not achievable. And then, of course, if there's any issues that come up, the dentist, the orthodontist can tell you, hey, we need to pause, we need to proceed a different way, we need to see another specialist. So I just think overall, it saves you time in the long term. It saves you your
Yes.
dental health in the long term, and it saves you money in the long term to see a specialist from the beginning.
And another thing that you didn't touch on is we take periodic photos. We can take some periodic X-rays, and those are, I mean, they're incredibly important because we can't see under the bone. You can't feel any difference if there's any trauma to the bone. Bone, for example, doesn't have any feeling. You're not going to notice if it's hurting unless you are that far in the wrong direction and it's really painful. So it's a good thing to be able to keep an eye on things and really to be ahead of the curve and to make sure that you're making the right decisions with your mouth and what you want to do as well.
Yeah.
I would say the biggest question everyone always has, and we'll touch a little bit on it, but it's really hard to give us and to give you guys a really accurate answer is pricing. What is the cost? That's always the number one question everyone wants to know.
Yeah, that again, I hate to give this answer, but it depends, right? So, not only does it depend on your specific case, but it actually even depends where you're located. So, geography is huge. Cities like Los Angeles or New York City, you're going to have much, much higher prices for the same treatment as you would somewhere in the
And just
Midwest.
to let you guys know, Marina, Dr. Gonchar, did work in New York City, and she's worked now in Jersey, so she really knows how geography and location can really change that cost.
Absolutely. And, again, it also depends. Are you going to see a dentist or an orthodontist? Some people think, oh, well, orthodontists surely charge more. And a lot of the times that's actually not true
Hmm.
because this is our specialty. The only thing we focus on is these types of treatments. We often charge less because we can get the cases done sooner, faster, more efficiently. And so that matters. But I would say the biggest determinant of cost would be your individual cost, your individual case. So how difficult it is, how long it will take, what are your goals, what are your expectations?
Yeah, and I think, on top of that, everyone always wants to know if insurance covers orthodontics or if there's a difference of insurance working with Invisalign or any aligner companies. And yes, insurance can cover orthodontic treatment. Many do. Looking at specific plans obviously becomes too convoluted to go over, but there is also no difference between using braces or aligners for treatment. So I think that's important to always know because a lot of people don't really think Invisalign or braces are covered, especially as you get into adults. A lot of people think it may only be covered for my child, which could be true, but many times, more so than not, orthodontic treatment, if you have it on your insurance, can be used for pretty much anyone on that plan. And that's something that when you go into the office, we can always look at and then give you a really specific, oriented, detailed plan that is geared towards your treatment and then the goals that we decide together. Talked a little bit about pain, talked a little bit about everything else with pricing and the main questions, but let's kind of talk about a little bit of the difference between aligner companies. In the past few years, we have noticed a lot more aligner companies in the market, especially in the United States. We see Angel, we see Ormco, 3M, Sure Smile, and plenty others that I don't remember the names of or even don't even know the names. But what are some of the differences between these aligners that you see?
I would say They're all pretty much similar. So the way I describe it to patient is, when they come in asking for clear aligners, they're asking for Invisalign, and Invisalign is a brand. So just like Kleenex is a brand, and there's other brands of aligners. And the thing that matters the most, I think, is how comfortable is the doctor with that product. So if they're using Invisalign, how comfortable are they treatment planning with it? If they're using Angel aligners, how comfortable is the doctor doing that? Because patients don't really know the difference between
Hmm.
aligners. And so, what I usually do is I show patients two different aligners and I ask them, do you know which one's which? So, these are two different companies. This is Invisalign, this is 3M. And to them, they both look pretty similar.
Hmm.
But again, to me, there's different uses for different companies. So I like 3M in expansion cases. Again, a little more technical, but from the patient perspective, it's just a brand. From my point of view, it's more about treatment planning and comfort level with the use of that aligner.
Yeah, I agree. I think there are differences between each of the companies, and some of them are important for the doctor to understand, and some are important for the patient to maybe be concerned about. But I think the biggest difference that some will see is if you look really close, you can see a little bit difference in the color of the plastic. Significant difference in the long run once it's in your mouth. I don't really see a difference, and I think some companies may have some claims on a staining. Maybe it doesn't stain as much versus this other company, and there could be some significant difference, but I see really no difference between most patients in the sense of what the trays look like after they wear them, what color they are. I think if you're one that really does a good job taking care of your oral health and also brushing the tray a little bit and taking care of that, normally the staining is pretty minimal. And some of it also is diet. Some people have different diets and drink coffee or have tea and a lot more spices in food, and that can affect the staining as well of trays, which I think companies don't necessarily tell you if you look on their website. But I think the biggest differences are kind of more of mild to the patient.
I agree. Yeah.
And I think as well, some of the biggest differences can be some of the attachments. I think some companies use a little bit more attachments than others. Now, how much does that really affect the patient? I think more it's doctor oriented. I think if you understand how to use the tray, how to use the software, we can achieve the same goals. And there really shouldn't be major concern with either of the brands that any dentist or orthodontist uses. There probably are some ones that are more in the infant stage of growth and development, and they may not have the same success or same predictability as some of the longer aligner companies on the market. But that would be kind of my only thought. What do you think?
Yeah, I agree. But some of the bigger brands, that people should be aware of, Invisalign, Angel, 3M, Sure
Spark.
Smile, Spark. I think those aligner companies have been around long enough and have been
Mhm.
used by enough doctors and dentists that you can tell that the results are good. You will get the, again, compliance, but you'll get what you want. So some of the newer ones, I agree. I don't know how well they work. I don't know if they're going to stick around.
Mhm.
But I would say, if a patient trusts their doctor, trust the system that they use, and they'll be in front of you. So sometimes if I want to use a new aligner, I'll tell patients, I'm like, hey, they're just starting out. Would you want to try this out with us? And sometimes people do, sometimes people don't. So.
Yeah, I think or at least when you go to your doctor and orthodontist, I think it's good if they're upfront with you and don't try to hide what they're trying to do. And I think that goes for any field, but if they're honest, they seem truthful to you, I think you should be able to achieve a really good result with really whatever you choose. I think another thing that I'd like to touch up on here at the end, and then obviously if we have something that we didn't go over and Marina would like to add, we definitely can. But we're both orthodontist, and Marina's a board certified orthodontist. And so we definitely may have a little bit of a bias, but what is the benefit of going to an orthodontist specifically? And I think we specialize and go to additional years of school to learn orthodontics and to understand tooth movement, jaw and growth development. But I think there are big benefits of seeing an orthodontist for your orthodontic care.
I mean, obviously, I agree. And like you said, we're probably a little bit biased, but the way I explain it to people, we went to dental school like everyone else. We did 4 years of dental school, and then we did an additional 3 years of just orthodontics. So basically, we went to dental school twice just to learn this field. So, and the other thing is experience, right? So we've both been out of school for about 10 years. It's there's a lot to be said for practice, practice, practice. And when this is the only thing that you do,
Right.
which is moving teeth, you're going to have, a lot of know-how. You're going to know how to deal with situations that arise that maybe a dentist wouldn't because they don't see as many cases. We're going to know how to maybe deal with a little more complicated situations, how to get around certain issues like periodontal disease, how to handle that. So again, obviously there's a bias just because it's our profession, but simply put, I mean, this is what we do day in and day out.
And I think with adding on to that, there are accessories. Now those start to get a little bit more involved and things that we don't necessarily need to go over here, but there are accessories that can help with jaw development. There are accessories that can help with moving teeth in certain directions, with the use of TADS, a temporary anchorage device, which is a mini screw that I don't know many dentists that do that because it starts to get a little bit more involved. It's definitely a little more complex treatment. But I think the biggest thing, especially since we're talking about aligners are wonderful. They're wonderful when they work. And I always say to myself, I should use aligners on every single patient, on the ones that work well. But there are some cases where the teeth just don't move as predictable as we expect. Even if the patient's wearing it perfect, they're wearing it 22 hours a day. And one thing we're able to offer is really quick is, well, why don't we use a little bit of braces, or let's try to attempt with some braces treatment, even for a short time. Yes, we know you wanted to do it clear and aesthetically pleasing, but sometimes things don't always work as expected. And I think that's one thing that the orthodontists were able to really help manage, because we don't want to try forever and ever and waste your time as well. Our business is to help you achieve your goal and to feel very comfortable with your smile and pleased with it. But also we understand time is important. So sometimes being able to place on braces, which we do as well, is a benefit.
Yeah, no, I completely agree with all of that.
Is there anything that you think that we have maybe left out that the, you know, average person would be interested in hearing about?
You know, not so much related to aligners, but just two quick points that I sometimes hear from patients, and it surprises me that it's not known more. But do orthodontists treat both kids and adults? And
Good
the
question.
answer is, of course, yes. So our specialty is not based on age, it's based on moving teeth. So we treat everyone from 7 years to 100. One of my oldest patients was 82. So it's never too late, okay?
Exactly.
Yeah.
Well, we had a wonderful time. It was really fun to be able to talk with you, Marina, and to go over, I think, a very important topic, and one that a lot of people are wondering about and don't always want to go in, because it can sometimes be a little uncomfortable to go talk to a dentist, orthodontist, or any doctor. And people like to try to find stuff online before going in. So hopefully this information can help you with making that decision. But otherwise, it was great having you on. We had a wonderful time. Hopefully you did too, and we'll see you again soon.
Yes, thank you for having me.